Hello, my name is Dr. Marsha Campbell-Yeo. I'm a professor at the School of Nursing in the Faculty of Health with cross appointments in the departments of pediatrics, psychology, and neuroscience at Dalhousie University. I'm also a clinician scientist and a practicing neonatal nurse practitioner at the IWK Health. And that's where my Canada Foundation of Innovation research lab called the MumLink is located. The many aspects of my research have demonstrated repeatedly that parents can effectively and significantly improve outcomes for the babies and families. What we found was during the COVID pandemic, parents were restricted from being in the NICU. In fact, many times only one parent could be there. Fathers often were not able to be present during any of their baby's hospitalization. And in some cases where families had to choose between children at home, homeschooling, or no childcare, their infants were actually left alone. So we know that this has adverse outcomes for babies and families, and we were particularly interested in trying to examine what actually was the impact of these severe restrictions applied during COVID-19 on neonatal families. This work has actually led to not only immediate changes for us to pivot the way that we provided care very early on in the pandemic, but it also allowed us to create virtual care pathways to address gaps, to ensure that we provide optimal care despite all the adversities of the pandemic. We're also able to identify the need to have two support people in the neonatal unit at all times. And in Nova Scotia, we saw that with wave 2 and wave 3, our research was instituted and we didn't see those severest restrictions again. I can't say enough about how important donor support is in ensuring that researchers are able to do the work that they need to do to actually improve outcomes. In my case, improving outcomes for vulnerable, high-risk neonates and their families. I'd just like to sincerely thank the DMRF donors for all they do to support researchers like myself, to allow us to do the work that we need to do to improve outcomes for for my case, children and families. And on a personal note, I also have to say that the funders really have provided the opportunity for me as a researcher who also faced significant adversity during the pandemic with restrictions, to be able to gain and have the foundation to be able to apply for larger funding, which will keep our lab going. And so again, thank you so much, not just for myself, but for the students that I helped to train for the next generation of researchers, and also to the babies and families that we serve. Thank you.